Our eyes are our portals to the world and are essential to our daily lives. Unfortunately, as we age, we become more susceptible to eye disorders as well as diseases. And when we go on Medicare, we have to understand exactly how Medicare is going to cover vision. In this video, I'm going to explain. Now, I want to begin this video by addressing some of the most common eye disorders as well as diseases that people on Medicare are having to deal with. Now, normally in our videos, I just speak to you and teach you using the board, but I have selected a few articles that I thought would really help us to really better understand how Medicare is going to work and the things that you're going to have to be addressing if you do have some of these eye problems. So the first one I'm going to talk about is the disorder of a refractive error. Now, I'm going to read something about refractive errors. Number one, this is when the eye cannot clearly focus the images from the outside world. And so the result of a refractive error, which we'll look at here in just a minute, would be blurred vision, which sometimes becomes so severe that it causes visual impairment. So these are refractive errors. Now, the first type of refractive error is going to be when someone has what is called an astigmatism. An astigmatism is basically this. It means that someone has a misshaped eye. Our eye typically is supposed to kind of be, if we're using an illustration, would be like the roundness of a basketball. But when someone has an astigmatism, what they have is they have an eye that's more like a football. And so it's in a different shape. And that astigmatism then is going to cause problems. It could be astigmatism in the cornea or the lens. But the whole point is there's an imperfection in the eye's curvature. And the symptoms that people have with these refractive errors would be blurry vision. They just cannot see well. And of course, these things are easily treatable. This would be also someone that would be diagnosed with being nearsighted, which means they can see things close up but not long distance, or they're farsighted, which means just the opposite. They can see things well that are in the distance but not up close. And so refractive errors are the most common. In fact, 1 out of every 3 people in the U.S. have an astigmatism. About 14 million people right now are farsighted. About 34 million people are nearsighted, and so very, very common. Now, the good thing about this is refractive errors are easily treated. Many people are treated just simply with glasses, some with contacts, and then some also with LASIK surgery. Okay, so that's the first one. And of course, we'll talk about how Medicare will cover these things in just a minute. But people are dealing with refractive errors. Now, that takes us to the second a common eye disorder, and that would be cataracts. Now, a cataract is a clouding of the eye's lens. Cataracts can occur at any age with a variety of causes, and some can even be born. Children can be born with cataracts. Now, the treatment for the removal of cataracts is very common. Simply, go in and have your cataracts removed. Oftentimes, they'll also replace the lenses whenever cataract surgery is going on. Now, cataracts affect many people. It's estimated that as many as 30 million people have cataracts. And so that's almost half of all people that are Medicare eligible are going to deal with a cataract situation. Now, the third most common eye disorder among the Medicare population would be those that have glaucoma. In fact, they estimate now that probably about 3 million people eligible for Medicare would have glaucoma, and about half of them do not know it yet. In other words, it's not so severe where they even understand that they're going to be diagnosed with glaucoma in the future. They have it, but it's in the early stages. And so glaucoma is this. It's a disease that can damage the eye's optic nerve, and the result of that is vision loss and sometimes even blindness. And glaucoma occurs when the normal fluid pressure inside the eye slowly rises. And because it does slowly rise, sometimes people don't detect it until it's too late. And so, again, glaucoma, a very serious disease that must be dealt with. Now, the fourth disorder that we need to address is what's called age-related macular degeneration. Now, this is probably, of this list, probably the most severe disease disorder that people are going to deal with. Now, age-related macular degeneration, it's often abbreviated when you read about it, AMD. And what it does, it affects the macula, which is the central part of the retina that allows the eyes to see fine detail. This would be if you're reading or driving, you're looking into someone's face, so the details, pictures, those kinds of things. Now, there's actually 2 different forms of macular degeneration. One is called wet and one is dry. Now, the wet form of macular degeneration is not the most common. However, even both are serious, but this one definitely would be more serious. And what it does, this occurs when abnormal blood vessels behind the retina grow under the macula, and ultimately what that leads to is blood and fluid leakage in that area. And so bleeding, leaking, and scarring from these blood vessels cause damage and lead to, listen to this, rapid central vision loss. So this is a rapid loss. And of course, central vision, this is really the most important part of our vision because again, it's what allows us to read and to drive and to see details and shapes and colors and pictures and people's faces. And if we're losing that, we're not able to clearly see these things. And so we want to see them clearly and sharply. But again, macular degeneration is going to damage that part of the eye, so we can't do that. So that's wet AMD. Now, dry AMD, this is when the macula thins over time as part of aging. And so this is a gradual blurring of the central vision. The wet macular is very rapid, dry is more over a period of time. Now this kind of macular degeneration is the most common. They say about 85 to 90% of all people are going to have dry versus the wet. Again, both are severe, both can certainly lead to blindness, and so this is something that people have to deal with and really pay attention to make sure they get proper care. Now the last one I want to mention that is very severe would be called diabetic retinopathy. Now this actually affects about 4 million people that are Medicare eligible, and 1 million of those 4 have very severe diabetic retinopathy. Let me explain what it is. It's a common complication of those that have diabetes. It usually affects both of the eyes. It's characterized by progressive damage to the blood vessels of the retina. And so it goes actually through 4 different stages, and of course in the 4th stage it could also lead to blindness. But what happens is the light sensitive tissue at the back of the eye that's necessary for good vision is going to be damaged because the blood vessel is damaged because of the diabetes. Again, very, very severe and has to be dealt with properly. What's also interesting about this particular eye disorder is that about 50% of all people that have diabetes do not pay attention to the effect that diabetes is having on their eyes. And so if they don't get really on top of that, what happens is this is a condition that is irreversible. And so again, this can be an issue that you may have to deal with, and we're going to look at how Medicare is going to take care of these disorders. So here you have it, the 5 very common disorders that people that are on Medicare are dealing with. And of course, as we age, these things become very, very important. So refractive errors, obviously treated by glasses, by contacts with some, and also LASIK surgery. All right. Now, when it comes to cataracts, this can be in one or both eyes, and very common then to have cataract surgery. Along with that, the replacing of the lenses. Now, glaucoma, because of that nerve damage, the pressure that is building up is going to cause that nerve damage. So this is something where people can certainly have eye drops and those kinds of things to deal with the glaucoma if they catch it early. And again, it can lead to blindness. And of course, this is the severe one, the macular degeneration. We've seen it's wet and dry. And so we're talking about different treatments for those. We'll see how Medicare would cover that. Most people that have wet macular degeneration are going to have injections in the eyes either every month or every other month. And of course, those are expensive, and I'll show you how Medicare will cover those. And then of course, those that have diabetes, they need to catch their eye issues early on. And there's ways that of course we can do that, and Medicare will cover some of those kind of things because that is, again, something that can lead to blindness. All right, so let's talk about how Medicare is going to cover these items. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. All right, so now that we understand what issues we may have to deal with in regards to our vision, let's talk about now how Medicare is going to cover those items to make sure that you have the kind of care that you're looking for with Medicare. So the first option when we go on Medicare, we can actually stay on what we refer to as Medicare A and B, which is original Medicare. And this just simply means that if you stay in the original Medicare system, Medicare is setting all the rules, what bills are going to be paid, what bills won't be paid. Medicare is going to process those bills. So that's the original Medicare system. All right. Now, you have to note that when we stay in original Medicare A and B, most people get a supplemental plan. I'll explain that in just a second. But here's my point. As we need issues with our eyes, whether, again, that's going to be cataracts or glaucoma, wet macular degeneration or dry, whether we have diabetic retinopathy or just some eye fraction, any of those kinds of things are going to be covered in some aspect by Medicare. And so if we stay in original Medicare A and B, let me show you how that is going to work. First off, Medicare is going to cover things very, very well when it comes to disease of the eye. The only thing Medicare A and B does not cover would be eye exams for eyewear. Okay? They just simply do not cover that. You would have to pay for an eye exam. Now, if you have a medically necessary eye exam, for instance, a diabetic gets usually 2 eye exams a year that are going to be covered by Medicare because those are medically necessary. So if it's just for eyewear alone, you just have to go in and make sure your prescription is accurate. Medicare is not going to pay for that eye exam. Now, if I'm seeing floaters or something else is going on, I'm having some kind of blurred vision, some cataracts developing, Medicare is going to cover those eye exams, but just not for eyewear, nor will Medicare cover eyewear, which means no glasses, no contacts, other than after you have cataract surgery. Then they would pay for eyeglasses or contacts, okay, because you typically have to have a new prescription after you have cataract surgery. Okay, so my point is this: Medicare A and B is going to cover all those items, okay, other than those 2 things. Again, medically necessary eye exams, just nothing for eyewear or eyewear, contacts, glasses itself, no coverage. So when Medicare covers, keep in mind, Medicare doesn't cover everything 100%. What you have in the original Medicare system are gaps. So let me just review those with you real quickly, because again, we're talking about our diabetic retinopathy, our macular degeneration, glaucoma, cataracts, those kinds of things. What's that going to look like? And so what happens if I stay in the original Medicare system? What we have is we have A and we have B. Okay, A is the inpatient side, which is hospital skilled nursing. B is going to be all the outpatient side as well as doctor. Now, most of your eye things that we just talked about are going to be covered on the B side. But just so we're clear, if you did have to have some coverage on the A side, meaning you're in the hospital, what's going to happen is this. What we have is we have 3 gaps in Medicare A and B. So on the A side, which means I'm in the hospital or skilled nursing, I have a deductible, and that deductible this year is $1,600. Now, when I say this year, that can happen multiple times in the year, but they reset these amounts every year. In other words, they give us new amounts. This will go up in 2024. But right now, this year, 2023, we have a $1,600 deductible if we are in the hospital. And that covers us all the way up to 1 to 60 days in the hospital, okay, which is most situations. Now, if I'm on the hospital longer than 60 days, that takes us to our second gap. And that would be day 61 to 90 will cost me $400 a day copay to be in the hospital. Days 91 to 150 are going to cost me $800 a day to be in the hospital. These are called extended hospital stays. They're not very common, but when they are, they're very expensive. And then lastly, when it comes to this last gap, this is for what we call skilled nursing facility. And this is for inpatient rehab after a stroke, hip replacement, something like that. First 20 days, Medicare says you owe nothing. But after that, if the 21 days to 100, you would have a $200 a day copay that you'd be paying. Most people are in about 35 days, so it's costing them about $3,000 out of pocket. But what I'm trying to teach you is these are your gaps in original Medicare A. On the B side, everything outpatient, all doctor services. Again, this is where most of your eye issues are going to be treated on the B side of Medicare. And so what we have is we have a deductible on the B of $226 this year. And that deductible resets every January. Now, this deductible once a year, this deductible on the A side could be multiple times. So this just simply means that the first $226 is going to be out of my pocket. So if you're going to have cataract surgeries, the doctor visits leading up to that, the surgeon, the anesthesiologist, the facility, all those kind of things will be covered by the B side of Medicare. You're responsible for your deductible, and then after that, Medicare is going to pay 80% of the bills on the B side, and you're responsible for 20%. We call this co-insurance. Co-insurance. Medicare pays 80 and you pay 20. So we've met our deductible, we've met our 20% co-insurance we're responsible for, and then what we have is a thing called an excess charge. And this most certainly could happen if you have a serious eye issue that you're having treated by a doctor or a surgeon. This is when the doctor adds 15% to the bill. and that's an excess charge. So this is a doctor that takes Medicare patients but does not agree to take the Medicare approved amounts, and so what they do is they add 15% of the bill. Medicare allows it, but you have to pay for it, and that certainly can happen with some of these eye issues because it requires a specialist. And so my point is there's 3 gaps on the A and 3 gaps on the B. So what's going on right now is this. Most people that are getting a Medicare, saying an original Medicare, what they're doing is they're buying a supplemental plan. And a supplemental plan is going to fill in the gaps. Most people are buying the G plan today, and it covers 5 of the 6 gaps. 5 of the 6, which means it covers everything on the hospital side. Going to the hospital or skilled nursing doesn't cost you anything. That G plan will cover those expenses. G plan will not pay the B deductible, but it will pay your full 20% coinsurance, and it will cover your excess charge as well. So that's my point. Someone has a G plan, supplemental, Medicare A and B pays first, supplemental plan pays second, pays everything, almost full coverage, other than once a year you have the B deductible. So if I'm dealing with any of those issues, macular degeneration, diabetic retinopathy, cataracts, glaucoma, all those things covered typically on the B side of Medicare. Certainly all the refraction issues when it deals with glasses and those kinds of things, that's going to be over here on the B side of Medicare. And so 5 of the 6 gaps covered, but once a year you'd have to meet that. Okay, now another plan that is very popular as well, not quite as popular as the G plan, is the implant, a little cheaper in price, but what it does is this. The in plan will pay all of this, just like the G plan did, covers all the gaps. It'll cover the full 20%. It won't cover the B deductible, and it will not cover excess charge. So you would be responsible for excess if that doctor adds 15% of the bill. So now we have 4 of the 6 gaps covered, plus every time you see a doctor, they can charge you a $20 copay. Go to the emergency room, you have a $50 copay. So you'll save about $30 a month in premium, but you're going to take on that excess charge as well as some copays. And again, one is not better, worse, right, wrong. It's not that. You just have to decide how much risk you're going to be comfortable with. Okay? And so that's staying in original Medicare. So if we have any of these diseases of the eye, what's going to happen? If I had A and B only, you have a tremendous amount of risk, a lot of gaps because you have to pay for all of them. But if I had that G plan and I have a serious issue of any of those 5 we talked about, what will you be out of pocket? $226. Now again, remember you're going to have to pay for your own eye exams for eyewear and your own eyewear for sure. Okay, but other than that, you almost have 100% coverage. So if we go through something serious like that macular degeneration, especially in the wet form, where you have those shots that are being put in your eyes, you don't self-administer those. You go to an outpatient clinic. Therefore, the B side of Medicare is going to cover those expenses. Once you've met your B deductible, you'll have nothing out of pocket. Same thing with cataract surgery. Nothing out of pocket other than once a year you meet your B deductible and you're going to be done. Okay, so we don't really have to pay much as we go. In plan, a little bit more exposure because we may have to pay excess charges as well and some copays along the way. All right, so that's one way in which we can get our eye disorders and diseases covered. Now, the second way in which people can use their Medicare is to have to be enrolled in Medicare A and B, which means we got to pay our B premium, and that's $164.90 a month for most people. That's called the B premium. And so this option here is I have to be enrolled in Medicare A and B, but instead of Medicare A and B processing bills and paying claims and setting all the rules, now we have a private health insurance company that's replacing A and B. Again, I'm enrolled in A and B, got to pay my B premium, but now I've gone to a private health insurance company that's going to take care of my Medicare benefits. We call those Part C plans or Advantage plans. Some people call those replacement plans. Now again, the only 2 things that these systems have in common is we have to be enrolled in A and B to have that supplemental plan, and I got to be enrolled in A and B to have a Part C plan. But what's going to happen here is this. This Part C plan, what they're going to do is typically there's 0 premium, all right? 0 premium. Now, what they're going to do beyond not charging a premium is they're going to throw in a couple of perks. These are little add-on benefits that original Medicare does not offer, and that certainly is part of this vision issue. And that is this: the perks that come apart, that are a part of the Medicare Advantage plan, will be they will give you a routine eye exam. Routine eye exam. Now, that doesn't mean that they're going to necessarily dilate your eyes. They typically do not a routine eye exam, but it's like a physical examination of the eye. And remember, Medicare doesn't cover only those that are medically necessary. So that's a perk given by the Advantage plan. You get one routine eye exam every year. If you had to pay for that, it probably costs you maybe $40 out of pocket, but you get one of those a year. Secondly, what they do is they give you an eyewear allowance. Eyewear allowance. Okay, and that varies anywhere from about $150 to maybe $250 a year, and that money can be spent on glasses, frames, lenses, those kind of things, or contacts. So again, they give you a little minimal, because remember, original Medicare doesn't cover any of that. So those are two perks that come along with the Advantage plan not offered in this option number one. Now, there's a couple disadvantages that you got to be aware of, though, when it comes to an Advantage plan with some of these eye diseases. I'm not paying a premium for that Medicare Advantage plan, but what I'm going to do instead is I'm responsible for co-pays. I will have co-insurance on some things, and even sometimes I'm going to be out of pocket, maybe even a deductible on my Advantage plan. Most don't have a deductible, but some do. But the point is, I pay as I go. No premium, so I pay as I go in this system. So what that could mean, if I'm on an HMO, that plan may have a max out of pocket of, let's say, $3,000 for the whole year, right? Or it could be a PPO is going to be $5,000 for the whole year. If I'm on an HMO, I can't go out of my network, so I'm bound to my network doctors, and so that could be a negative. You want to go to an ophthalmologist or some surgeon, and they don't take the plan, you can't go there on an HMO plan. On a PPO plan, you can, but if they're not on the network, now you could spend upwards to $10,000 out of pocket. And so the whole point is there's no premium, but in this pay-as-I-go system, you're going to deal with networks. HMOs, you've got to stay in the network. PPO is a larger network, and if you go out, you can, but it usually costs you about twice as much money. So again, I don't know what issue you may be dealing with, if it's a diabetic retinopathy or a cataract, glaucoma, macular degeneration, but those things are going to be expensive, and instead now you're going to pay as you go until you hit the max out of pocket. So that's going to be treated differently. Another difference would be here, because the Advantage plan has these networks, you will be limited in your providers. Not every doctor, not every surgeon is going to take them. Up here in this system, any doc, any hospital, any surgeon that takes Medicare, you can go anywhere you want to on your supplemental plan. But here you could have some restrictions. And again, this is one way in which people can get all those services covered, but now we're going to pay as we go. And some of these eye diseases could be very, very expensive. And especially like the injections. You could be responsible up to 20% co-insurance until you hit your max for the year. All right? And so, now by the way, just so you know, I think having an Advantage plan is better than having A and B only for sure. A and B only is the riskiest position. The best really is to have A and B and get that supplemental plan to fill in the gaps. But if someone doesn't want to get a supplemental plan, then they can get an Advantage plan, zero premium, and just pay as you go until you hit the max. All right, so that shows us how we can get our surgeries covered, our doc visits, specialist visits, eye exams, all those kind of things can be covered medically in one of those two systems. Now, we also could have some diseases or disorders that are going to be treated maybe with eye drops or some type of ointments, infections, those kinds of things. And that's going to be covered through Medicare Part D plans. Now, what happens if I have this option up here, I actually add a Part D plan to that. It's a separate plan. You pay a separate premium, and you actually pick the plan out. When you have an Advantage plan, what they do is they actually add that drug plan to it. So Part D plans can be either standalone or they can be included within the Advantage plan. The big key here is you got to make sure that your prescriptions are well covered. And they sometimes are, sometimes not so well. Up here, you get to pick the plan to make sure you're on the right plan based upon the meds you take in the pharmacy you want to go to. So the whole point is this. You are going to have prescriptions that will be needed for your eyes. That's just the way it works. And so I'm not going to go through all of them. I did a search on my own, and there are literally 100 different types plus of different eye drops and eye ointments for infection. So there's a lot of things in the market today that are going to be necessary for some of your treatment. So what you have to do is you have to make sure that you have the right prescription drug plan. Again, drug plans can be changed. Medicare Advantage plans can be changed on an annual basis. And so each year you got to make sure you're going to be on the right drug plans. And so what's important to note about drug plans is this. Some drug plans you have to meet a deductible. That deductible this year is $505. This is 2023, $505. That's going to $540 next year. So that deductible this year is $505. And why that matters is because if you're going to be on some brand name medications, some expensive medications, normally you're going to have to pay that $505 deductible on medications that are going to be expensive, and certainly most brand name medications are going to be. So once we've met our deductible, then what we do is we just simply go into copays. And the copays are very reasonable. Most of the expensive meds are going to be about a $45 a month copay. But what's happening right now this year and next year is they track the retail cost. And so if they get to $4,660 in retail cost, not your cost, but retail cost, then that's what pushes us into what is called the coverage gap or the donut hole. And the reason I'm mentioning this is because if you do get to the donut hole, and you could with some of these eye medications, if you get the donut hole, then what happens is your copayment goes to 25% flat copay of the coinsurance. So your medications could be kind of expensive there. All right, I'll give you an example in just a second. And so that's stage 1. Stage 2, Stage 3, and then Stage 4 is called catastrophic. Now, the catastrophic is going away in 24 and thereafter, but right now, catastrophic just simply means if we get to catastrophic, we pay a 5% copay, coinsurance. So it's really, really cheap in that one, so not a big deal. But I'm sharing this with you is because some of these eye meds that are expensive could be a little bit painful in the donut hole, and I'll give you a quick example. And all I'm trying to teach you is that you are going to need meds for some of these eye disorders. Now, again, I told you there's well over 100 different medications that are available. Let's just talk about the issue of dry eyes. Very, very common today. Now, most people that are getting dry eye treatment are getting one of 3 meds. They're getting Restasis, Zidra, and then also cyclosporine. And so those medications are very common. Let's just talk about the Restasis and the Zidra. They cost right now on a retail basis about $700 to $800 a month. Now again, they come in different ways you can administer them, little vials, others just a larger bottle. But the point is it's about $700, $800 every month. So if you're on that medication, rest assured, if you have a deductible on that drug plan, you're going to meet that. And then after you've met the deductible, then those eye drops are going to be very, very low cost until you hit that full retail total. And so let's just say it's $700 a month. Retail, you'd pay your deductible, you'll pay your copay on your second fill. But what would happen? $700 a month times 7 would be, what, about $4,900. So within about 6 to 7 months, you would be in the donut hole. And so then your copay would jump up to 25% of that $700. All right, and so those copays are going to jump up to about $175. So I meet my deductible, I pay copays until I hit the retail threshold there, which puts me then in the donut hole. And so here I'm going to pay about $45, but here those eye drops could cost you $175 a month. Now, if you got to catastrophic, you wouldn't care. It's going to cost you then $35. But most people don't get to catastrophic. But the whole issue is here on some of these expensive medications. They could be, it's not going to be crazy money out of your pocket, but it's going to be some out of your pocket. So if you can be on a generic medication, then of course, then you probably won't have to worry about your deductible whatsoever. But anyways, those are very common for dry eyes. Now, glaucoma medications right now for the generics are very inexpensive. Most people are either using latanoprost or they're using timolol. And again, those retail from anywhere from $10 to maybe $30 a month. And if you're on a plan, you could have a copay of a couple dollars. And so again, very, very low cost. But I shared all this with you because I know for sure that prescriptions are going to be a part of your treatment for these different eye diseases and disorders. All right, so you want to make sure that you're on the right prescription drug plan. So as you can see, Medicare is going to provide you wonderful coverage for these diseases and these different disorders. You just have to decide how you want your inpatient and outpatient to be treated, whether that's through original Medicare with a supplemental plan or through a Medicare Advantage plan. And then, of course, course, we're going to have a prescription drug plan because, again, we have eye drops and salves and ointments and different things that they're going to use to be able to treat these diseases. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now lastly, let's talk about trying to keep our eyes as healthy as possible so we don't get into these kind of problems, or if we already have a problem, how it is that we can live our lives in such a way that our eyes are being properly cared for. Number one would be digital eye strain. This is a big issue today because of our phones and our iPads and our computers and different things. And so what is highly recommended is this. When we continue to stare at all these screens, we're bringing about this eye strain. And the symptoms of eye strain can be dry eyes, can be headaches, can be blurred vision, and even can be neck and shoulder pain because of this. And so what is real common today is what they call the 20-20-20 rule. And what they're saying is that if you have a tremendous amount of exposure digitally, which most of us do, that you need to take regular breaks, 20-20-20. And what that means is that every 20 minutes, you need to move your head away from your screen or your iPad or your computer. Move it away and pause for 20 seconds and try to focus on something that's 20 feet away. So again, every 20 minutes, take at least a 20-second break, focus on something that's 20 away. And again, that'll help you in regards to digital eye strain. The second thing you need to do, really, it's interesting, nutrition. Really, our nutrition is a significant factor that affects our vision. Studies have shown this, that certain nutrients such as vitamin C and vitamin E and zinc and omega-3 fatty acids are crucial for maintaining healthy eyes. In our diet, our foods, leafy greens, fish, nuts, citrus fruits, can also help prevent that age-related macular degeneration. So again, more greens, more fish, nuts, citrus, all those kind of things. That's important. It'll also help with cataracts and dry eyes, all those things. So those nutrients actually protect your eyes from damage that's caused by free radicals and reduce inflammation, which in turn causes more eye diseases. All right, so in contrast, what happens, I can have that kind of a diet, or I can have one that's high in saturated fat and sugars, and what that's going to do, it's going to increase the risk of me developing these 5 diseases that we talked about. So the point is, nutrition is important. Thirdly, eye exams. Maintaining eye exam schedule is crucial to detect any underlying conditions with the eye. And the point is, as you get these examinations, if we detect these things early on, they're going to be able to be treated. If you put them off too long and they're detected later, it certainly can be an issue, especially those of you that have diabetes, high blood pressure, those kind of things are really impacting your eyes. And so it's recommended to get a comprehensive eye exam every 1 or 2 years, depending upon your age and risk factors. Remember, if it's medically necessary, Medicare is going to cover those. And certainly if we have problems, blurred vision and those kind of things, Medicare will cover those eye exams. So be sure to have a regular schedule of those. And then number 4, lifestyle. And primarily this has to do, in this article that I read, it was just encouraging those people who smoke. You know, I know it's a tough thing to habit to break, but for sure, you got to realize that smoking can indeed affect your eyes. In fact, this article said this, that smokers are more likely to develop cataracts, which of course is the clouding of the eye's lenses, and then eventually could lead to impaired vision and even to blindness. And so smoking increases also the risk of developing that age-related macular degeneration. So if you can, give up the smoking as well. And then lastly, sun exposure. Very, very important. Let me just read this to you. This author said this: prolonged exposure to ultraviolet radiation can cause damage to the eyes, leading to various eye conditions, of course. Exposure to UV radiation is associated with an increased risk of developing cataracts, which of course clouding the eyes, the lens, vision loss. Additionally, UV radiation exposure can cause damage to the retina and increase the risk of developing the age-related macular degeneration. So he says this: it's critical to protect our eyes from the sun's harmful UV rays by wearing sunglasses that block at least 99% of UVA and UVB rays whenever you're outdoors. So bottom line is, sunglasses, very, very important for the health of your eyes. So these are the critical things that you need to know when you go on Medicare as it relates to proper vision care.